It's because just like a nuclear detonation, there's fallout associated with those. Well, there's fallout associated with these nuclear verdicts.
Welcome to Off the Chart with Medical Economics, a podcast featuring lively and informative conversations with healthcare experts, opinion leaders, and practicing physicians about the challenges facing doctors and medical practices. I'm your host, Keith Reynolds, and today we feature a conversation between Medical Economics Editorial Director Chris Mazzolini and Bob White, President of the Doctors Company. This one is an in-depth look into state-level changes to malpractice caps, the recent explosion in massive plaintiff verdicts, and what all this could mean for your bottom line.
Bob White, President of the Doctors Company. Thanks so much for joining me on the show today.
Well, I'm happy to be here, Chris. I'm looking forward to talking to you.
Let's start with a definition of the topic we'll be discussing, medical malpractice damage caps. What are they and why are they important for physicians to know about them?
Damage caps are a way that individual states choose to address limitations on damages that can be awarded to patients who sue healthcare providers for claims. Generally speaking, they only apply to non-economic damages. There are a couple of states that limit a total recovery, which also includes the economic losses. But generally speaking, they only apply to non-economic damages, and states enact those laws as a way of controlling loss costs, which are the main drivers of insurance premiums. And most of these states that enacted caps on non-economic damages did so at a time when insurance was either unavailable or unaffordable for doctors, and they passed this element of public policy as a way of controlling the cost of insurance to keep healthcare available and affordable in their states.
So are these caps something that are they stay the same every year? Are they, linked to inflation or anything like that? Can you kind of describe like how these tend to grow?
Sure. There are some caps on damages that were enacted with inflationary escalators that are tied to an index like the Consumer Price Index, and they go up every year, every 2 years, depending upon what the law says, to keep pace with inflation. There were some states who enacted non-economic damage caps that had no inflationary escalator associated with them, so they sit where they were at the time the cap was enacted, and in some cases that goes back to the middle of the 70s, the 1970s, and California, for example, is a state like that, and Colorado is also a state like that had caps with no escalator associated with them.
You bring up Colorado. I know that there's been some news lately about malpractice caps in Colorado. Can you talk a little bit about what's going on in that state and, why it's something that, doctors should take note of?
Well, what's going on in Colorado is actually a carbon copy of what went on in California, okay? And in 2019, the plaintiffs' bar decided to get enough petitions, signatures on a petition to put a referendum on the ballot to abolish the cap on non-economic damages in California. That was scheduled to go on the ballot in the presidential election of November of 2020. But because of the COVID problem, they chose to defer that pursuit of that initiative to a later date because they were concerned that voters would be enamored with doctors and healthcare providers, and it wasn't a good time to try to abolish the cap. So they reinstituted their pursuit in late 2021. And what happens is both sides do polling to determine what their positions ought to be and how best to tell their story to the public. And the side that was fighting to keep the cap on the books started looking at the polling results and feeling that they didn't have a good chance of defeating the referendum. So they entered into negotiations with the plaintiffs' bar. And the plaintiffs' bar and the side representing healthcare providers that benefited from the cap worked out a compromise that allows the cap to go up over a 10-year period. And then after it goes up to the maximum at the end of 10 years, it has an inflationary escalator that keeps the cap moving north. What happened in Colorado is precisely the same thing that happened in California.
So just for context for our listeners, can you explain a bit, like, what are the numbers we're talking about? Like, what is the cap right now in California, if you have that?
Well, today the cap in California, it just went up again. I think it's 400,000. And it goes up it's in 2023 is when the change took effect. It was 350,000. I think it goes up in $50,000 increments every year for 10 years. Okay.
Okay.
And the cap is part of the package in California. What the plaintiffs' bar got in California is not just an increased cap, but prior to this new legislation, there was only one cap in California and it applied to all healthcare providers. So the patient only got one cap, okay? You could only collect before the change $250,000 and that's all you could collect. Now California has 3 caps associated with the law. You can have one for a doctor, a second cap for another doctor, and a third cap for a healthcare institution, okay, or a healthcare entity. So not only do they have a cap of about $400,000 today, but they have 3 of them. So essentially, if the plaintiff's lawyer is creative enough to find causes of action that they can successfully prosecute against 2 doctors and a healthcare entity, the cap is essentially $1.2 million per claim for non-economic damages.
Yeah, in Colorado, you're saying that we're basically seeing the same situation play out that we saw in California.
Well, Colorado's law is already passed, okay? They went to the table with the plaintiffs' bar just as California did and negotiated a deal that they presented to the legislature and got the legislature to pass a bill that both sides negotiated and agreed upon. And so that law was passed, I believe, in May, and it is a done deal.
Okay. When we see the plaintiffs, when you're saying the plaintiff's bar is pursuing this, just for general context in our conversation, what is the reason why? Like, what is their argument for increasing the caps?
Well, they honestly feel they're advocates for their potential clients, okay? And they feel, and the problem with caps with no escalator is a cap passed 40 or 45 years ago may have been a good thing and made sense 40 or 45 years ago, but it doesn't apply to real life today. You can also look at it from the standpoint of who else benefits besides the patient. The lawyers do, okay? Because the whole idea behind pain and suffering was to create a pot of money to pay a legal fee, a contingency fee, because it's hard for people to award money for economic damages and economic losses alone, knowing that a lawyer is going to take a piece of your lost wages, your medical bills, all of those things that came out of your pocket. So a long time ago, the whole concept of pain and suffering was brought about primarily to manufacture a fee for the contingency fee-based plaintiff's lawyer.
Okay, yeah, thanks for sharing that context. That helps. Is this something you had described a bit before, how different states have sort of different, laws and rules on the book when it comes to caps? Is this a trend we're going to see in other states, like because of what California and Colorado have done? Are there other states that are going to try to follow suit?
Well, there are 26 states with caps. What we're seeing, and it's all related to social inflation, is an effort to roll back tort reforms across the board. The trend isn't for there to be new caps. In fact, the most recent new cap that was enacted was Iowa back in, I believe it was 2022 or 2023, in response to a $97.4 million judgment against a hospital and a group of OBGYNs for a brain damaged baby. And once they saw that verdict, that became the poster child for tort reform, and they immediately passed a cap on non-economic damages. But clearly, tort reforms are under attack all across the country. There's just the American Tort Reform Association just awarded 5 states the title of lawsuit infernos for raising their cap, as Maryland and New Hampshire did. Missouri was one of the states they cited for defeating 5 bills, the most important of which from a potential defendant's point of view was lowering the statute of limitations from 5 years to 2 years. Their legislature defeated that bill, and they also awarded Colorado that designation for the passage of their tort reform bill, and New York for the Grieving Families Act, which would, it's been passed twice before and vetoed by the governor. This is the 3rd year they've passed it, which would give New York the most lucrative wrongful death statute in the country and allow people to recover that no other state allows to recover in a wrongful death claim. So it's the trend driven by changes in societal attitudes is clearly tort reform rollbacks. And when you hear us talk about social inflation, that's part of the mix that we're talking about.
Say, Keith, this is all well and good, but what if someone is looking for more clinical information?
Oh, then they want to check out our sister site, PatientCareOnline.com, the leading clinical resource for primary care physicians. Again, that's PatientCareOnline.com.
I mean, obviously we just kicked off the football season, and one of the things I think about with like malpractice damages is that it's almost like an athlete's salary. Like once somebody breaks that barrier and signs a lucrative contract, it seems like other similar things sort of follow suit. Is that sort of what we're talking about? Like once you get a giant verdict like that 94 million one that you had mentioned, then is that sort of like raise the sea level on all of these things? Is that sort of what we're thinking about here?
Well, actually, societal attitudes changed, and that's engendered these verdicts, okay? In the last 10 years, the number of verdicts in excess of $10 million nationwide has increased 400%. In other words, from beginning of 2014 to the end of 2023, we saw verdicts in excess of $10 million go from 12 per year in 2014 to 59 per year in the end of 2023, okay? And the average of the top 50 medical professional liability verdicts that we watch these every year, the average has gone up 240% from 2014 through 2023. In fact, in the 1-year period from 2022 to 2023, the average of the top 50 verdicts went from 32 million to 48 million, a 50% year-over-year increase in the average. That's what we're talking about here.
So obviously you have these societal pressures. To get back to the topic of the caps a bit, what have you at the doctor's company and just in the malpractice insurance industry in general, what have you found as some of the after effects of caps rising? Like what are the side effects, for lack of a better word, on what happens when these caps rise?
The effects on us are the effects on every insurance company.
I think both the effects on the malpractice industry, but even more important, the effects on physicians and physicians who maybe are dealing with an adverse event. Like what is sort of the after, like when a cap rises, what happens as a result? Do we see more lawsuits? Do we see higher verdicts? What are we talking about here?
Well, the pressure on the people who have to make the decision about whether to try a case or settle it, you're less likely to try cases when you see verdicts happening at least once a week somewhere in this country that are astronomical. Okay. So what it does is it tends to cause us to want to try fewer cases, for one thing. And on the other hand, when you're in the claim settlement process, talking to the plaintiff's lawyer about settling a case, they write demand letters to us that go to a copy of it goes to the doctor. Okay. In these cases, or the hospital. And they talk about how their case compares to other cases that have been tried in that general vicinity. Okay, that venue is what we call it. And they try to pick cases that are similar in terms of their facts and circumstances and similar in their injury to the one that we're trying to settle. And they'll show you these big verdicts. Okay. And these big verdicts not only lower our desire to try these cases, but they drive up how much it costs us to settle them. And nothing drives up loss costs faster than settling more cases and paying more for every settlement. Okay, that's the fallout. When we call these cases nuclear verdicts, it's because just like a nuclear detonation, there's fallout associated with those. Well, there's fallout associated with these nuclear verdicts, and that's the fallout. Okay. Verdicts are the yardstick by which every settlement is measured. Okay. And that's the axiom that we deal with. And when you're a doctor and you look at these numbers and you have $1 million policy, as most doctors in this country have, you have to ask yourself, do I want to risk everything I've taken a lifetime to earn to try to protect my professional reputation? It's a difficult question. They're already suffering from burnout because of all the things that are going on in society. And then you put this decision and the risk associated with this decision in front of them, just hastens the syndrome.
Yeah, I
Drives
mean, a lot of
further
doctors.
and faster.
Yeah, I mean, I imagine a lot of doctors are sort of like, when you're facing one of these situations, it's got to be, incredibly stressful, are sort of, wrestling with, wanting to prove their innocence, but then the potential risk, like you said, of, dealing, like it's like, so I imagine the pressure to settle is probably very high.
It is, and we still have doctors who feel strongly about defending their cases. But if we don't turn this situation around in the courtroom, it's going to just get worse as time progresses. The biggest verdict in 2014 was $62 million. The biggest verdict in 2023 was $485 million. The biggest verdict in 2024 is $535 million. Okay.
Wow.
So we're talking about humongous numbers. Okay. Yeah. And it's just, something has to be done. And the obvious answer is caps. Okay. But caps are being eroded. The public's heart just isn't in caps. It may take further restrictions on access to healthcare before they see the connection between what they're doing to the medical profession through these cases and the quality of their own life. Yeah. They've already lost the disconnect because the problem of nuclear verdicts isn't just associated with medical professional liability. It's across the board. They haven't gotten the message that they're paying for more for goods and services when they find against these companies. Yeah, I think there's a feeling that there's some corporate irresponsibility that they're trying to correct. And it's true that the tactics the plaintiffs' lawyers are using in this courtroom have helped engender these big verdicts. It's called the reptile theory. It was put forth in a book in 2009 written by a trial lawyer and a jury consultant who's usually a psychologist. And it teaches them how to use tactics that cause fear in the minds of jurors. In other words, it triggers the part of our brain we inherited from the reptiles Neuropsychologists tell us that's the area where the fight or flight syndrome emanates from. And they use tactics designed to show the defendant as a threat to the community safety who has to be punished in order to deter others from acting in a similar way. So they're getting these verdicts to punish the defendant, a total perversion of our court system, which was designed to make an injured party whole.
Yeah.
And yet we're producing verdicts that enrich the next 5 generations of the plaintiff's family.
Oh, you say you're a practice leader or administrator? We've got just the thing. Our sister site, Physicians.Practice.com, your one-stop shop for all the expert tips and tricks that will get your practice really humming. Again, that's Physicians.Practice.com.
Yeah, so I'm thinking as we're talking, like for physicians, they always tell us at medical economics how much sort of the fear of malpractice. It's like one of those main things that like keeps them up at night, right? Of worrying about something like this creeping up. And what advice? Obviously, at the doctor's company, you guys are, you have physician clients, policyholders, and you have data about when things go right and when things go wrong. What advice do you have for physicians? Like, what are the basic stuff that they need to do, sort of their defense hygiene to protect themselves from, you can never eliminate it completely, but what are some of the things that you can do that you have to make sure you're doing, or maybe stuff you shouldn't be doing to make sure you're as ironclad as you can be if something comes up?
Well, doctors hate to hear it, but it begins and ends with a good set of records. And there's a lot out there in the way of electronic healthcare records now that help cue logic and completeness in charting. And so we like those systems. And there's some of these that are capturing the conversation, for example, between a patient and a physician, which is good from the standpoint of making the doctor more connected to the patient when they're in the exam room and helping to build rapport. And it used to be that what was generally true was also true of malpractice cases. You had to not like somebody in order to sue them, okay? Today, it's not so much the truth. It's an economic exercise more than anything else today. But building rapport was also an important aspect of this. And it remains that today, although it's probably less true today. I always talk to doctors about talking to their patient with 1 foot in the hallway and 1 foot in the exam room or their hospital room. You may say all the right words and you may say exactly the same thing, but your body language is telling the patient a different story. Building that rapport with a patient and getting that patient to feel comfortable enough to ask you the kinds of questions they need to ask to get comfortable with a less than perfect outcome is probably the most important thing, because the bottom line that drives patients to plaintiffs' lawyers is to get answers the patient couldn't get from a healthcare provider, okay? So making that patient comfortable enough with you as a person to ask you the things that are bothering them, along with a good set of records, is probably the best protection you could have against a lawsuit.
One thing as you were speaking that I was thinking about is how, many of our physicians that, we talk to a lot of physicians on a regular basis, and there's been a feeling, I think, and, our main audience is primary care, and which is very relationship driven, but there's been a lot of sentiment lately that like healthcare has become more transactional, right? More patients are, going to like, whether it's like the pharmacy, clinic, or an urgent care, or like, it's like, I have an ear infection, I need to get that dealt with. And there's less about the relationship. And I wonder if, what your thoughts are on like sort of some of that relationship sort of eroding out of modern healthcare that is kind of maybe contributing to some of this.
Well, we refer to it as retail medicine. When you go to CVS or you go to Walmart to shop, and you also make a visit to a healthcare provider in the retail setting. And that's a little bit on the problematic side, because that rapport that needs to get built may not be built quite the same way. Over time, I may get proven wrong on that. I mean, it all comes down to how well that healthcare provider, regardless of the setting they're in, relates to the patient and makes that patient feel comfortable. But these are things that create barriers for that rapport to be built when it's transactional and not seen as a rendering of a personal service, a deeply personal service. And that's how we want patients to feel, deeply involved with their doctor.
Yeah, I mean, definitely, like from what we hear from physicians is that's what that's why they went into medicine to begin with.
In the first place.
They want that relationship. I guess the last thing, we've covered a lot of ground. Is there anything, whether it's about damage caps or anything in regarding to the malpractice market that we haven't discussed that you would like to mention?
No, I think doctors have a lot of choices out there. We're a doctor-owned company, and I always feel concerned when I hear doctors talk about us as just another set of letters in the alphabet soup of insurance companies they could buy insurance from. And I think when doctors look for their choices, they need to look at the business model the company is working with, and we're by our members, who are all doctors, and for our members. And everything we do, we are not a scorekeeper. Okay, there are even some doctor-owned insurance companies who have become scorekeepers. In other words, they take the losses, they add their overhead, and they send out the bills. Okay, that's how involved they are in trying to change things. You want an insurer that's going to advocate for you. Okay, across the country, if they're big enough, as we are. Okay, we're a nationwide insurer. We get involved in over 5,000 pieces of legislation across the country. We are not willing to accept the status quo, as a lot of insurance companies do. You want somebody who's going to advocate for you, because advocacy is the only thing that's going to turn around the problems we've been talking about here today.
Bob White is the president of the Doctors Company. Bob, thanks so much for joining me today. I really appreciate it.
Chris, it was a pleasure to be here.
Again, that was Medical Economics Editorial Director Chris Mazzolini and Robert White, the president of the Doctors Company. My name is Keith Reynolds, and on behalf of the whole Medical Economics team, I'd like to thank you for listening and ask that you please subscribe to the show on Apple Podcasts and Spotify. Also, if you'd like a digest of the best stories Medical Economics publishes delivered straight to your email 6 days a week, subscribe to our newsletter at medicaleconomics.com. Medical Economics, Patient Care Online, and Physicians Practice are all members of the MJH Life Sciences family. Thank you.